Temporomandibular joint imaging. As you all know, the temporomandibular joint has got hard tissue components and also soft tissue component. The type of imaging technique for TMJ will depend on the specific clinical problem, need for imaging the hard tissue or soft tissue, amount of information that has to be gathered, the cost, and also the radiation dose to the patient. So the TMJ imaging can be divided into hard tissue imaging and soft tissue imaging. The hard tissue imaging is again divided into conventional form of imaging and also the tomographic form. Conventional form includes transpharyngeal view, transcranial view, transorbital view, submentovertex view, and also the reverse down projection. Tomography includes orthopantomograph, CT, and also the CBCT. Coming to the soft tissue imaging, the techniques used are ultrasonography, MRI, and arthrography. Hard tissue imaging is used for the evaluation of osseous contour, positional relationship of the condyle and fossa, range of motion, and it uses a combination of imaging technique. The abnormalities in hard tissue will include bony ankylosis, arthritis, remodeling, developmental abnormalities, neoplasm, trauma, fracture, range of motion, and also it can include asymmetry. Soft tissue imaging is done for the evaluation of disc position, morphology, integrity, and also the muscles and the surrounding tissue imaging. The abnormalities in soft tissue can include positional deformities, perforation of the disc, ankylosis of the disc, joint effusion, inflammatory condition, and also calcification of the joint space. First one is the panoramic projection or the OPG. This radiographic technique is basically used for screening purpose. So the uses of panoramic projection includes to identify any gross osseous changes like asymmetry, extensive erosion, osteophytes or fractures. And it can also include any odontogenic diseases and also other disorders which can be the source of the TMJ symptoms. But the limitation of a panoramic projection can include limited view of the condyle fossa relationship, low quality images, a thicker layer view of the structures is given, then the TMJ will be oblique and distorted view is obtained. Also, mild osseous changes will be obscured. Next is a transcranial view. In this projection, the patient is positioned in such a way that the sagittal plane is perpendicular to the ground and the cassette is placed parallel to the sagittal plane. And the film is placed within the cassette and is placed flat against the ear and centered over the TMJ of interest. The central beam of X-ray should enter through a point 2.5 inches above and behind the external auditory meatus. The vertical angulation is 25 degrees, horizontal angulation is 20 degrees, and the point of exit should be the TMJ of interest. This transcranial projection can provide both closed and maximally open position of the TMJ and can see the lateral contours of the condylar head. So the main use of transcranial projection is for identifying any gross osseous change on the lateral aspect of the temporomandibular joint and also other uses like detecting any arthritic change on the articular surface, joint space calcification, etc. Limitation of transcranial projection is that superimposition of the same side petrous part of the temporal bone. Also, change in the central and medial aspect of the TMJ cannot be viewed. Only the lateral aspect can be viewed. Next is a transorbital projection. It is also known as simmer projection. In this technique, the patient is positioned in such a way that the sagittal plane is perpendicular to the ground, and also the mouth should be in open position. The film is placed within the cassette and is placed behind the patient's head, making an angulation of 45 degrees to the sagittal plane. And the central ray is passed with a plus 20-degree vertical angulation, and the point of entry is through the opposite side orbit through the medial canthus. The use of transorbital projection include viewing of the anterior part of the temporomandibular joint. Also, medial displacement of the fractured condyle can be viewed. The limitation of this view is that only the neck is seen in cases of reduced condylar movements. Next projection is the transpharyngeal projection. It is also known as Parma projection, infracranial projection, and also McQueen-Delp technique. The patient positioning is with the mid-sagittal plane perpendicular to the ground, and the cassette is placed parallel to the sagittal plane, and mouth is in an open position. The central ray should enter at making an angulation of -5 to 10 degree and should pass through the mandibular notch of the opposite side TMJ. The film is placed against the patient's ear and is centered to ½ inch anterior to the external auditory meatus. And the exit point is coronoid, condyle, and zygomatic arch of the opposite side below the skull base. Parma modification means it is a modification of the Parma projection. In this technique, the red line cone of the tube head is removed and the tube head is brought close to the skin of the patient. Therefore, magnification of the tube side structures occurs and the superimposition will be reduced in the final image. So the use of the transpharyngeal projection include viewing of the medial aspect of the condyle. This is the main use of transpharyngeal projection. The limitation is that temporal component is not well imaged and only open mouth position is possible. Next technique is the submendovertex view. In this, the patient's head is placed at the center of the cassette, and the neck and head should be tipped backwards as far as possible, so as the vertex of the head touches the cassette. And also the mid-sagittal plane should be making 90 degree to the film plane. The central ray of X-ray beam should be 90 degree to film and the sagittal plane. And it should pass through an imaginary line joining the mandibular first molars of the patient. The use of the submendovertex view is to identify the axial inclination of the condylar head. Also for evaluating facial asymmetry, rotation of mandible, displacement of condyle in case of trauma. Another technique is the reverse Townes view. In this technique, the film is positioned perpendicular to the floor and the long axis of the cassette should be in a vertical position. The central ray should pass perpendicular to the film and also point of entry is at the level of the mandible along the mid-sagittal plane. The patient should be positioned in such a way that the sagittal plane is perpendicular and also vertical to the film. The forehead should touch the film and mouth should be wide open. The use of reverse down projection is to view the fracture of condylar head and neck. Also, in case of condylar hypoplasia, and intracapsular fracture of TMJ. These were the conventional technique of TMJ heart tissue imaging. And moving to the tomographic view, we have OPG, CT, and CBCT. So coming to CT, this will provide us, this is the process by which an image layer of the body is produced by blurring the layers above and below the layer that has to be identified. Uses of CT includes 3D shape of each structure can be viewed. Imaging of complex fracture, internal osseous components can be viewed. In case of extensive ankylosis, neoplasm, extent of bone involvement in arthritis, etc. So moving on to soft tissue imaging. Indication of soft tissue imaging includes any condition which affects the intra-articular disc. So we can, indications include disc position, disc morphology, integrity information, and also for the soft tissue, that is, and muscles and which are surrounding the temporomandibular joint. First is the MRI, or the magnetic resonance imaging. This is a technique which uses non-ionizing radiation. It uses the radio frequency pulse and also the magnetic field. The advantage of MRI is that image reconstruction can be done in all coronal, axial, and sagittal planes, and useful for diagnosis of medial disc displacement. And also it is a non-invasive technique. So next one is the ultrasonography, or simply USG. This is the study of tissue of human body with utilization of reflection of high frequency sound waves. A transducer is used to generate high frequency ultrasound waves, and the reflected light or reflected sound waves will be caught by piezoelectric crystals, which are found inside the transducer. So this technique can be used in case of disc displacement and effusion. Another technique is arthrography. This is the indirect image of the disc by injection of a contrast media into the upper and lower compartments. The procedure includes catheterizing of the upper and lower components and injecting around 0.5 to 1 ml of radiographic contrast media. Usually iodine compounds are used. First, the lower compartment is filled, followed by the upper one. So the use of arthrography include to detect any perforation of the disc, to study adhesion of the disc, and for gathering information regarding the disposition, function, and morphology. But the limitation of arthrography includes, as the iodine-based agents are used, there is risk for allergy to the contrast media, and the injection technique is a bit painful. Also, it is not indicated when patient is hypersensitive. And so in some cases, it can cause fibrosis. And while following arthrography, a very strict aseptic procedure should be used, and also contraindicated in case of acute joint infection. The complication of arthrography include accidental introduction of the contrast media into the brain that can happen through the glenoid fossa, which can eventually cause conventional fatal reaction, shock, local allergy, or inflammatory conditions. Another technique is the arthroscopy. This is very similar to arthrography. This is a technique of direct visualization of the internal joint, and it is a last line investigation, and it is used to view the articular cavity condition. Advantage is that it is a safe procedure. We can directly visualize the joint, minimal postoperative complication, and the TMJ can be directly viewed. And also biopsy and surgical procedure can be easily visualized. To conclude with, TMJ is a very complex joint and it can have a multiple pathologies. So the correct positioning for clear and non-superimposed image is required for a proper diagnosis and also a proper treatment planning. So we should be knowing which technique to be used for which condition. Then only we can come to a proper diagnosis and plan a proper treatment. Thank you.